and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract only once. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check answers. Part A. In this part of the test, you hear 2 different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a patient called Eugenius. For questions 1 to 12, complete the following notes with a word or short pause. You now have 30 seconds to look at the notes.
Hello, Doctor. Good morning.
Good morning. What's your problem?
Doctor, he is my son, Eugenius. A few hours ago, he fell off his bicycle. He was not wearing a helmet. He went unconscious for a few seconds. He complains of neck pain now.
Does he have any other illness?
No, Doctor.
Okay, what's his age?
12 years, Doctor.
Any previous injuries?
Very minor injuries, Doctor.
Was he taking any medicines?
No, Doctor.
Does he smoke or drink?
No, Doctor.
Can you tell me more about family history of illness?
Absolutely no illness in our family, Doctor.
Any weight loss or gain recently?
No, Doctor.
Well, his physical examination shows his blood pressure 150/75, pulse rate 80, respirations 18, temperature 37.4, saturation 97% on room air. He is moderately obese. His neck is symmetric, the trachea is in the midline, and there are no masses. No crepitus is palpated. The thyroid is palpable, not enlarged, smooth, moves with swallowing, and has no palpable masses. Normal respiratory effort. There is no intercostal retraction or action by the accessory muscles. Normal breath sounds bilaterally with no rhonchi, wheezing, or rubs. The point of maximal impulse is palpable at the 5 ICS in the MCL. No thrills on palpitation. S1 and S2 are easily audible. No audible S3, S4, murmur, click, or rub. Abdominal aorta is not palpable. No audible abdominal brutes. Femoral pulses are 3+ bilaterally without audible brutes. Extremities show no edema or varicosities. Gastrointestinal investigation shows no palpable tenderness or masses. Liver and spleen are percussed, but not palpable under the costal margins. No evidence for umbilical or groin hernia. No lymphatic nodes over 3 mm in the neck, axilla, or groins. Musculoskeletal test shows normal gait and station, symmetric muscle strength and normal tone without signs of atrophy or abnormal movements. There is a hematoma in the forehead and one in the occipital scalp, and there are abrasions in the upper extremities and abrasions on the knees. No induration or subcutaneous nodules to palpitation. I have reviewed his chest X-ray and it is normal, right hand X-ray, which is normal, and an MRI of the head, which is also normal. He has concussion, facial abrasion, scalp laceration, and knee abrasions. Admit him today and his health condition will be monitored by our team. We have observation team working 24 hours. Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Mr. Gregorius. For questions 13 to 24, complete the following notes with a word or short pause. You now have 30 seconds to look at the notes.
Hello, doctor.
Yes, come in. What's your problem?
Well, he is my husband, and he had a markedly abnormal stress test with severe chest pain after 5 minutes of exercise on the standard Bruce with horizontal ST depressions and moderate apical ischemia on stress imaging only.
What's his name?
He is Mr. Gregorius.
What is his age?
55, doctor.
Well, his cardiac catheterization today shows mild to moderate left main distal disease of 30%, moderate proximal left anterior descending coronary artery with a severe mid-left anterior descending coronary artery lesion of 99%, and a mid-left circumflex lesion of 80% with normal left ventricle function and some mild luminal irregularities in the right coronary artery with some moderate stenosis seen in the mid to distal right patent ductus arteriosus. He shows rest anginal symptoms, as well as nocturnal angina symptoms, and especially given the severity of the mid-left anterior descending lesion with a markedly abnormal stress test. I am prescribing him aspirin 325 milligrams once a day, Nexium 40 milligrams once a day, Zocor 40 milligrams once a day. Plavix 600 milligrams, which I am giving him tonight. I would suggest that you transfer him for percutaneous coronary intervention.